We have been practicing reproductive medicines for the last 35 years in the city of Kolkata. Ours is the 5th IVF center in the city, and today there are now about 65 IVF centers catering to the various needs of fertility women in Kolkata. The birth of Louis Brown in 1978 through the pioneering Bob Edwards and Patrick Steptoe ushered in a new area of reproductive medicines. Since then, millions of couples all over the world has been benefited by this. As you all know, the current infertility figure according to ICMR guidelines is around 17%. The incidence is rising both in women as well as in men, and together with combined forms of infertility. The incidence of infertility in women is rising because one of the primary reasons is delayed age of childbearing, because they are pursuing careers, academic excellence, and due to other social or familiar pressures, they want to defer their childbirth, and that is putting them at a risk of diminished ovarian reserve. Together with the other factors, namely PCOS, endometriosis, pelvic inflammatory disease, and so on and so forth, the incidence of infertility in women is rising. The male, on the other hand, the semen parameters are decreasing, so much so that WHO has been forced to decrease the semen parameters in 2 occasions in the last decade of this century. The rise of incidence in males is primarily because of lifestyle modifications. The incidence of diabetes and hypertension is increasing, along with other stress factors and factors which affect sperm production. So there is a great need of fertility care improvement in these couples to give them a chance of achieving a baby. IVF, on the other hand, has developed remarkably in the last 40 years since its inception in all spheres, namely in the development of drugs, in the laboratory standards, and the development of ICSI, which has been instrumental in providing fatherhood to many male partners who are so far incapable of producing their own offspring. So that is how the modern improvements in IVF, improvements in IVF in modern practice has improved the hope of these couples in producing their own children. Together with this, as we all know, the incidence of malignancies, be it hematological malignancies, ovarian malignancies, cancer cervix, breast carcinomas, and in the male, various forms of lymphomas or lymphadenopathies and other diseases has produced a great need of preserving their gametes so that they can produce their own child with these gametes once their treatments for malignancies are resolved fully. So there is now a question of egg freezing, be it social egg freezing, remembering the growing age of the woman, or embryo freezing, depending on a lot of couples who are desirous of fertility, not at this particular moment, but maybe in future, to preserve their own gametes or embryos so that they use them in the later years of life. The concept of cryopreservation is a very remarkable advancement, along with the vitrification procedures in IVF, which has remarkably helped these couples. So, ladies and gentlemen, at the conclusion, IVF over the years has improved leaps and bounds and has raised even hope in these infertile couples who are desirous of preserving their fertility and giving birth to a child of their own gametes in future.